felt a lump in your breast and wondered if it's okay? It's a bit like a mystery, right? Imagine this, you're checking, and there it is, a lump. Now, you're asking yourself, is this normal? Should I be worried? Get ready, because we're going to figure this out together. Have you or someone you know faced this mystery of finding a lump in the breast? What questions do you have about it? Share your stories, and let's chat about it. Let's make a space where we share stories, learn new things, and support each other. Ever had a moment when you were scared, but it turned out okay? Or maybe you have advice for others who feel worried. Comment below. Once upon a time, in a small town nestled between rolling hills and peaceful meadows, there lived a woman named Angela. Angela was a vibrant soul, known for her infectious laughter and warm, welcoming smile. She led a simple life, surrounded by friends and family who cherished her presence. One ordinary day, as Angela went about her routine, she noticed something unusual. A small lump in her breast caught her attention, and a wave of concern washed over her. Unable to dismiss the nagging worry, Angela decided to take action. She promptly scheduled an appointment with her general practitioner, hoping for reassurance and a quick resolution. The general practitioner listened attentively as Angela described her discovery. Concerned for Angela's well-being, the doctor decided to refer her to a specialist for further evaluation. Angela, though nervous, appreciated the proactive approach and trusted that the specialist would provide the answers she sought. A week later, Angela found herself in the specialist's office. The experienced oncologist and breast cancer specialist conducted a thorough examination and ordered a series of tests known as the triple test, a combination of imaging, biopsy, and laboratory analysis. As Angela anxiously awaited the results, the specialist approached her with a mix of empathy and professionalism. The air in the room felt heavy as the words hung between them. Angela, the specialist began gently, the triple test has confirmed that the lump in your breast is cancerous. It's important for us to discuss the next steps. Angela felt a whirlwind of emotions, fear, sadness, and uncertainty, but the specialist's compassionate tone and reassuring presence provided a steady anchor. Together, they delved into the details of Angela's diagnosis, exploring the type and stage of the breast cancer she faced. The specialist explained the available treatment options, outlining the potential paths they could take. Breast cancer is one of the most common cancers that affects women. It happens when cancerous cells in your breasts multiply and become tumors. About 80% of breast cancer cases are invasive, meaning a tumor may spread from your breast to other areas of your body. Breast cancer typically affects women age 50 and older, but it can also affect women younger than 50. Men may also develop breast cancer. Healthcare providers determine cancer types and subtypes so they can tailor treatment to be as effective as possible with the fewest possible side effects. Common types of breast cancer include invasive, infiltrating, ductal carcinoma, IDC. This cancer starts in your milk ducts and spreads to nearby breast tissue. It's the most common type of breast cancer in the world. Lobular breast cancer. This breast cancer starts in the milk-producing glands, lobules, in your breast and often spreads to nearby breast tissue. It's the second most common breast cancer in the world. Ductal carcinoma in situ, cyst-like IDC. This breast cancer starts in your milk ducts. The difference is cyst doesn't spread beyond your milk ducts. Paget's disease of the breast. This rare cancer affects the skin of your nipple and may look like a rash. Less than 4% of all breast cancers are Paget's disease of the breast. Healthcare providers classify breast cancer subtypes by receptor cell status. Receptors are protein molecules in or on cell surfaces. They can attract or attach to certain substances in your blood, including hormones like estrogen and progesterone. Estrogen and progesterone help cancerous cells to grow. Finding out if cancerous cells have estrogen or progesterone receptors helps healthcare providers plan breast cancer treatment. The condition can affect your breasts in different ways. Some breast cancer symptoms are very distinctive. Others may simply seem like areas of your breast that look very different from any other area. Breast cancer may not cause noticeable symptoms either. But when it does, symptoms may include a change in the size, shape, or contour of your breast. A mass or lump, which may feel as small as a pea. A lump or thickening in or near your breast or in your underarm that persists through your menstrual cycle. A change in the look or feel of your skin on your breast or nipple. Your skin may look dimpled, puckered, scaly, or inflamed. It may look red, purple, or darker than other parts of your breast. A marble-like hardened area under your skin. A blood-stained or clear fluid discharge from your nipple. Experts know breast cancer happens when breast cells mutate and become cancerous cells that divide and multiply to create tumors. They aren't sure what triggers that change. However, research shows there are several risk factors that may increase your chances of developing breast cancer. These include age, being 55 or older. Sex. Women are much more likely to develop the condition than men. Family history. If your parents, siblings, children, or other close relatives have breast cancer, you're at risk of developing the disease. Genetics. Up to 15% of people with breast cancer develop the disease because they have inherited genetic mutations. The most common genetic mutations involve the BRCA1 and BRCA2 genes. Smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. Drinking beverages containing alcohol. Research shows that drinking beverages containing alcohol may increase breast cancer risk. Having obesity. Radiation exposure. If you've had prior radiation therapy, especially to your head, neck, or chest, you're more likely to develop breast cancer. Hormone replacement therapy. People who use hormone replacement therapy, HRT, have a higher risk of being diagnosed with the condition. The most significant complication is metastatic breast cancer that spreads to other areas of your body, including your brain, bones, liver, and lungs. Studies show about 1 in 3 women who have early-stage cancer later develop metastatic breast cancer. Healthcare providers may do physical examinations or order mammograms to check for signs of breast cancer. But they do the following tests to diagnose the disease: breast ultrasound, breast magnetic resonance imaging, MRI, scan, breast biopsy, immunohistochemistry test to check for hormone receptors, genetic tests to identify mutations that cause breast cancer. Healthcare providers use cancer staging systems to plan treatment. Staging cancer also helps providers set a prognosis, or what you can expect after treatment. Breast cancer staging depends on factors like breast cancer type, tumor size and location, and whether cancer has spread to other areas of your body. Breast cancer stages are: Stage 0, the disease is non-invasive, meaning it hasn't spread from your breast ducts to other parts of your breast. Stage I, there are cancerous cells in nearby breast tissue. Stage 2, the cancerous cells have formed a tumor or tumors. The tumor is either smaller than 2 cm across and has spread to underarm lymph nodes, or larger than 5 cm across but hasn't spread to underarm lymph nodes. Tumors at this stage can measure anywhere between 2 and 5 cm across, and may or may not affect the nearby lymph nodes. Stage 3, there's breast cancer in nearby tissue and lymph nodes. Stage 3 is usually referred to as locally advanced breast cancer. Stage 4, cancer has spread from your breast to areas like your bones, liver, lungs, or brain. Surgery is the primary breast cancer treatment, but healthcare providers may use other treatments. Breast cancer surgeries include mastectomy, lumpectomy, breast reconstruction. Providers may combine surgery with one or more of the following treatments: chemotherapy, radiation therapy, including intraoperative radiation therapy, IORT, immunotherapy, hormone therapy, including selective estrogen receptor modulator, SERM, therapy, targeted therapy.